Good morning. Good morning. This is Dr. Yonnette with another episode of Baby Talk. It is such a pleasure to be with you today. Today I am having an icy day outside, and so I am here coming to you a little later than I normally do because I have some extra time. They're treating the roads, and so we are being advised to stay off the road until later. So, how are you? How are you? How happy and content are you during this time of year as baby is growing? For some of you, this is your first Christmas with baby, and it's so exciting as time goes by and baby becomes more and more aware. It is going to be such a fun experience opening gifts together and seeing baby's excitement and growth and development. Today, I want to talk with you about anxiety and depression because, sadly, some of our children experience these conditions. And especially this time of year, even adults go through some form of depression and anxiety because of what this season brings, of being together, and the joy for some individuals, some children, is taken out of this time of year, this time of celebration, this time of joy. So let's talk a little bit today about anxiety and depression. Many children, many children have fears and worries, and they sometimes feel sad and hopeless from time to time. I remember when I had one of my family members over spending some time with me. She had such a difficult time going upstairs by herself. She had a fear of being alone in an environment where she's alone. So for some children, that fear goes on and on for a long time. It's a strong fear, and it's different from time to time as the child develops. Toddlers have a fear. Some of them, when their moms or dads leave, they cry. They feel unsafe. But although they are afraid and they worry, it's the fear subsides. It doesn't persist. But there are other children where the anxiety and the depression stays for a long time, and so it becomes a part of their diagnosis. So the information I'm sharing with you comes from the CDC, and let's talk about anxiety. Anxiety is when a child does not outgrow that fear that I was talking about earlier. The child worries, and it's typical in young children, or it's a worry that is more. It's not typical in young children, and when there are so many fears and worries that the child's school and home and play activities are interrupted, then the child may be diagnosed with an anxiety disorder. Here are some examples of anxiety disorders, some examples of different types of anxiety disorders. Being very afraid when away from the parents. So the child has separation anxiety. You may drop your little one off at daycare or at a babysitter, and your child is crying and crying and crying, and your child cries for hours, and nothing will console that child. Having an extreme fear about specific things or situation, such as dogs or insects, or going to the doctor, like having some phobias. There's another anxiety that deals with being very afraid of school and other places where there are people, where you have what we call the social anxiety, and then being very worried about the future and about bad things happening, where this is actually referred to as being a generalized anxiety. and then having repeated episodes of sudden, unexpected, intense fear that comes with symptoms such as heart pounding and having trouble breathing, or feeling dizzy or shaky or sweating, which we call like a panic disorder. So, anxiety may present as fear or worry, but it can also make children irritable and angry. So you want to check in with your child, see what is happening in your child's life. How is your child interacting? How is your child behaving in different situations? Anxiety symptoms can include trouble sleeping, as well as physical symptoms like fatigue, headaches, and stomach aches. And some children keep their worries to themselves, and so the symptoms are missed. But we have always been journaling, and journaling doesn't stop at infancy. You want to keep journaling about your child's development and what you're noticing. Maybe at this point, as your child is older and at school age, you are doing a video journaling. It's so convenient these days. You can pick up your phone and just speak into the mic and record what you've been seeing. So that journaling is continuing even as the child is older. And you can see these episodes or these symptoms that are impacting your child if your child is going through anxiety. Now, what about depression? Depression occasionally, being sad or feeling helpless is a part of what every child goes through. But if your child feels sad or uninterested in things that they may have enjoyed in the past, or feel helpless or hopeless in situations that they are able to change, then your child has this persistent sadness and hopelessness. They might be diagnosed with depression. So here again, we are seeing lots and lots of examples in our community where people are depressed and they take their own lives, and then we wonder what just happened. But these signs, these symptoms were there, but we have to be aware, we have to interact so we find out exactly what is happening in our loved ones' lives, in our children's life. Here are some examples of behaviors that children with depression will often show or exhibit. They're feeling sad, they're hopeless, they're irritable a lot of times. They're always irritable. They're not pleasant to be around. They're not wanting to do or enjoy fun things that they would do previously. They are showing changes in their eating patterns. They're eating a lot more or a lot less than they usually eat. You're also noticing that in these children, their sleeping pattern changes a lot. And so they're sleeping either more or less than they normally do. And then they're showing changes in energy, being tired and sluggish or tense and restless a lot of times. You want to cue in if you see that your child is having a hard time paying attention and feeling worthless or useless or even guilty about things that have no connection to the child. And then look for self-injury or self-destructive behaviors. I recall one particular child who was covering up. She was cutting herself, and she was constantly wearing these long sleeve clothing so that nobody would notice. But as a parent, you want to know what your child is doing. Spend time with your child. Even if he or she's a teenager, go into his or her room, lie in the bed with her, just interact and find out how life is actually going. A great way to spend time with your teenagers is to have meals together. Mealtime is such a bonding time, and that way you can understand the experiences that your child is going through. For some children, they may not want to talk about their helplessness or their hopeless thoughts, and may not appear sad, because depression can also cause a child to make trouble or act unmotivated, or cause others not to notice that the child is depressed, or have difficulty labeling that child, and so you end up saying the child is a troublemaker or the child is lazy. Now, I'm going to stop here in terms of talking about the definitions for these two terms, and tomorrow we can continue with adding some more details. But I want you to remember, as a parent, moms and dads, it's your responsibility to help your child succeed in life. You want to give the environment that is the best environment for success. So you are working very closely with your child, and as a parent or parents with a baby, you are in such an important place to make sure you are having those connections with your child, to make sure you're observing and seeing what the needs of your child are, and then also keeping a journal so you know what to share with your child's pediatrician when you reach out for assistance. I just loved the opportunity that I had to raise my child. And I know, parents, that you are also loving this opportunity. I wanted to encourage you in every way possible that you read and be knowledgeable so that you can provide all that your child needs. Whether or not your child is developing appropriately or your child is struggling with some areas of development, just become equipped to handle the situation in the best way possible. We all come with different needs. So be ready. Speak to the people who can help if you think you don't have the tools. Speak with an occupational therapist, your pediatrician, nurse, the speech therapist, and give your child the best opportunity to succeed. Take care of baby as you take care of you, and have a great day. This is Dr. Yonnette saying thank you for joining me, and I'll see you tomorrow.